Thank you. Thanks so much, Erica, and thank you all for being here. This is just one of the many events that are going on for Caregiver Support, Family Caregiver Support Month, and I'm happy to present this to you. Pleasant events. It's definitely a good thing to talk about. We can go on to the next slide. We already know about that. So our overview today, we're going to review a little bit on dementia care. I know several of you know about this already, but we'll just touch on some things just to refresh our memories about it. We're going to learn about pleasant events, and what we use here at the Sioux Falls VA for interventions is STAR VA, and then we'll talk a little bit more about that. Pleasant events are one of the 4 pillars of that. And then we're going to learn to facilitate pleasant events for those that maybe just are searching for some more tools in the toolkit. So dementia is, as we know, it's a brain disease. The brain is actually dying, which is, kind of hard for us to grasp when we first get this diagnosis or we have a loved one that has it. And so on the left, we see a normal brain and how large that is and healthy. And then on the right, we see the Alzheimer's brain where it's, diseased and it's starting to shrink. So we're going to lose some of those faculties associated with that disease process. And just to be sure that we all know that dementia is not normal aging, there are certain things that are part of normal aging, like some common forgetfulness and such, but dementia goes deeper than that. It also impacts all areas of our brain function, and it ultimately causes a lot of difficulties in our daily activities. So when I mentioned at the onset here of STAR VA, what is STAR VA and why do we use behavioral treatment? So the acronym STAR VA is actually explained as Staff Training in Assisted Living Residences. So that can be across the board. It happens in the hospital. We have caregivers in the hospital. We have caregivers at home. We have caregivers in facilities. We have caregivers in assisted living facilities as well. So STAR VA, why we chose it is it's a person-centered approach used to manage chronic dementia-related behaviors. It's evidence-based, so it's been proven to be effective, and we like to use what we know has been tested and tried, so we don't, mess up when we do this stuff with our veterans. We also know that medications can only do so much, and that behavioral treatments really do work. So as I mentioned about the 4 pillars of STAR VA, pleasant events is one, and then we have 3 other ones. We have developing realistic expectations. We have using effective communication, which is talked about a lot, no matter what relationship you're in. And then we talk about the ABCs of behavior. So why is STAR VA important? It's always good to go back to the beginning. So we know that dementia prevalence is increasing. 97% of our dementia patients exhibit these dementia-related behaviors that we're going to come to know all too well. And we know that those patients are more likely to be hospitalized than patients without dementia. That with those behaviors, there comes falls and mishaps that lead them to the hospital, or just some unexplained behavior that, a caregiver is not able to accommodate. We also know that they tend to stay longer than our patients without dementia. It's difficult to stabilize those behaviors just treating with medications only. It's difficult to find an alternative placement for them if they can no longer function at home because of the needs are too great. And so there's layers involved in there that make it that the person remains in the hospital longer. So when we talk about developing realistic expectations, if we have unrealistic expectations, knowingly or unknowingly, they can lead us to feeling misunderstood, we feel hurt or angry, and we may blame. And that's not where we necessarily want to be, but that's how we end up. If we develop those realistic expectations, they help us to keep calm, think and act carefully, and measure our words and our actions to appropriately meet the person where they're at. So, realistic expectations in regards to planning and judgment. Um, with the diagnosis of dementia, a person loses a lot of their ability to plan or reason. So, in order to effectively navigate that, we want to avoid reasoning. We try to not make so many words in a sentence that we talk to the person about. We try to not persuade them to our way of thinking, and we just try to be more agreeable. We also use substitution instead of subtraction. So, what that means, instead of taking something away and telling a person they can't have that, we try to replace it and say, how about this instead? We also simplify the tasks that we're asking the person to do so it reduces the complexity of it. And we also want to establish more of a familiar routine and simplify our physical environment to avoid feeling overwhelmed for the person and increasing their agitation. So, realistic expectations, awareness, and behavior. So, what we might notice with someone with dementia as it progresses, they start to lose their personal hygiene and social tact awareness. So, there may be times where, showers don't occur as frequently. We don't have the same ability to choose clothing and change clothing without cueing and without assistance. We also might stand too close to someone or shout instead of talking in normal tone. There could be a lot of things. Things get blurted out. That rolls down to our next item here with being disinhibited and impulsive. So that ability to reason and to keep ourselves in check is starting to get compromised and impaired. So things get blurted out in public. Things might get said at church. Things might get said in front of family that that person would have never said had they had that full intact working brain. And so we know that, and it's our job to respond accordingly. The person with dementia is losing that ability. So, and they also have a loss of initiative, spontaneity, and indecision that starts to creep up more. So, what that means is instead of them saying, hey, I'd like to go for a walk, or maybe I'd like to go for a drive, or I want to go to church, or I know I have this appointment, that's starting to be compromised, and we're going to have to help them with much more frequency. So, my topic here of pleasant events, I'm going to ask you some questions. Who has them? Why are they important? When did it become a pleasant event? Where can I find them? And how do they fit in with someone who has dementia? Well, in order to find all of that out, we need to start at the beginning. What do we mean by pleasant events? It's anything that can add pleasure to someone's day. So all of us have them, and sometimes we don't talk about them with other people, but we all have them, and we know them internally. Our job as investigators with an individual with dementia is if we don't know them, we need to start asking some question of the people that know them best, or even of themselves if they can ask, if they can still answer this, and get those answers. So here's what research has shown. Pleasant events can help to lower depression, anxiety, and agitation. They help us to promote a positive relationship between our staff or our caregivers and the veteran. And they increase the veteran's independence and sense of community. Everyone is looking for that sense of belonging. And so we want to give that back to the person with dementia. We also have something that's called music and memory, and we use that a lot in our community living centers or the CLCs here at the VA. Did you know that we have this program? And if you didn't, there's a little history here. It was first brought to our facility by now Rehab and Extended Care Chief Dr. Leslie Cook. Any member of the IDT that works with our veterans can consult our team, the Behavioral Recovery Outreach Team, to determine if a veteran would benefit from music and memory. Once we review that, and with the interdisciplinary team, the veteran will be set up to participate in the program. We've done this a lot with our people on the CLCs, and have found it to be very beneficial to help to promote that sense of calm and well-being, because most people can relate to music and they have a favorite genre or artist, and we build playlists for them based on that. Veterans who are identified as having a form of neurocognitive disorder and have completed a musical preference assessment with the recreational therapy team will be considered for the program and reviewed by our program and the IDT. And once they admit to us, our rec therapy team conducts their own assessment. And then with the help of the veteran family or family member or caregiver, we identify their musical choice and preferences, and then we start that whole assessment process. We find that a lot of times veterans prefer music maybe from their younger years. So it's really important that we have family to talk to about that, because they may not remember particular songs or particular artists, but once we get those musical selections going, things start to come back for them. So one of the things that's really important is that we meet people where they are at. Here are some stages of dementia, the early, middle, and advanced dementia stages. And here are some things that you can see that are starting to change with the person. You know, early on, you may see that they're still, you know, cognitively intact enough to carry out a lot of the former habits and stuff that they were used to. They can converse pretty easily. They can carry on a conversation. They still realize who people are, and they can make some choices. But they also have some deficits that might be occurring that we just ask you to be aware of and help to increase your tolerance for. That they lack an initiation of a task, that they have difficulty with some of their ADLs, and that they may discontinue things that used to be more challenging for them. So if they like to put together puzzles or read, that might require a lot more cognitive space, and so they may easily give that up. You can continue to prompt them and see if it's helpful or offer to read to them or something like that, but it doesn't mean that they're going to readily choose that. And then we go into the middle stages where you see more things that are starting to happen, that conversations start to be shorter. They don't have quite as much engagement. And they might rely a lot more on things that are written or that you point out to them. And they might forget how to complete a task or that they've already done it. And then when a lot of times by the time someone is enrolled in the BRO program, they might be more into that advanced dementia. And so our care team needs to really rise to the occasion and be doing a lot more for them. This also puts a lot more burden on our caregivers that are home with someone in that category. And so, you know, here at the VA, we offer a lot of support for you in your journey with your veteran, and we want to make sure that we're offering those services to you. But you will see these things occur, and they may take you by surprise, and that's what we're here to help pick apart for you and offer some suggestions and interventions for. So to continue this, if we were going to look at how to determine some pleasant events that might be effective, there are some listings here of things that you can easily do. And this is really, when we do follow up with a lot of our caregivers, we find that they're doing a lot of this. We get a lot of people that are telling us that they're going out walking, that they're still gardening, that they're still spending time with friends, that they're trying to maintain a lot of routine and familiarity so that things stay very consistent, which we really advocate for. And when it starts to shift to those mid to late stages, then again, you know, we've got the caregiver who is literally in the driver's seat, where they're driving the veteran around or initiating through reading the newspapers and books and helping to cue in about let's watch the birds, let's watch the squirrels, let's go out and do an activity. And sometimes that might be met with a little resistance. And if it does, then we just change it up and go back to the drawing board. So, how to arrange pleasant events for a person with with dementia? Just make sure that you are aware of what was fun for the person with dementia, and we do that a lot through interviewing. And if we can't get the information from the veteran, then we ask the family members to contribute. And so we do something here at the Sioux Falls VA, what's called a How to Have a Good Day, and that helps our staff to know what are some things that you can interject with your cares given for a pleasant event with a veteran. We also advocate that you do a lot to divide the pleasant events and make it specific to what they can manage as far as time and energy involved, and just really watching to see if they're getting tuckered out or losing interest and being willing to pivot and go on to doing something else. So there, these are some good tips just to remember for those of us who are caregivers to make sure that we keep it within reason, but that we're offering it all the same. This is an assessment, and you are certainly welcome to use this. It's straight from our STAR VA manual. This is something that's kind of a tracking, a spreadsheet, so to speak, of things if you want to kind of like track where your veteran's at and their interest in doing these things. And then their frequency of using it and how often it's been implemented. It's just a nice tracking tool. And just tagging back on that, here are some other things that can be referenced to from that same manual of recording. And then also offering off to the right here where we have like a whole list. If you can't think of things or they say no to certain things, just work your way down the list and see. Sometimes you'd be surprised. Someone that may not have liked to have had like their hand massaged in the past may really warm up to that. So we don't know until we try it. And so we need to, again, be those investigators and be thinking collectively about how we can kind of meet the mark for these pleasant events. And here is something, again, to gauge planning those pleasant events and if they are going to really be effective. Again, this is a tool that you can use if you find it applicable. You certainly don't have to use something this formalized, but it's available if it's of benefit. And if it helps you, like some of us, myself included, like to write things down, if it makes more sense to do that, then this is a helpful working tool to do so. So now we're going to get into some pleasant events. So if you haven't thought of things in the past, these are some places to start. So engaging a person with dementia in pleasant home-based activities, really, focusing on keeping it simple, keeping it, very tangible and easy to pull out. They can reduce the education, spark the memories, and provide a sense of purpose. And we want to personalize these activities and base them on the person's past hobbies, interests, and current abilities. So one thing that has been very effective is sensory and reminiscing. And one of those ways to do that would be to create a memory box. And that's just basically a lot of, mementos, or if there's military awards or badges or anything like that, it talks here about postcards, favorite music, or anything else from when their working years. That's very important for a lot of people to remember. I mean, we spend sometimes 45 years of our life, working in a full-time career. That's an important part of our history. Listening to music, we touched on that with Music in Memory, to create that playlist of favorite music, especially those songs from their youth, and then listening and singing along to those familiar songs. That helps really a lot to boost mood and start to really waken up those memories. People have been shocked by how someone with advanced dementia can all of a sudden remember lines of songs and sing along with it. Also tactile things we can touch and explore, like blankets, soft blankets, smooth stones, fabric, they also help to provide that calming and familiar experience. Um, Scents, this can be a tricky place to go because some things can be a little off-putting. But if it's aromas like baking cookies and coffee, favorite perfumes, all of that stuff tends to have a very strong emotional memory, and it can really bring back some things. I mean, who can't walk past a lilac bush and, oh, remember those lilacs from when I was a kid? We also can create scent jars with different spices, flowers, or scented lotions. These are just some things that we may not just typically think about, but they're there and they might be very easy to put together. We also talk a lot about food. Food is very important for someone with dementia because as the world starts to shrink and things start to fall by the wayside, quite often foods are something that remain, and so favorite foods like a favorite recipe or a familiar dessert, focusing again on the simple pleasure of tasting and enjoying the moment. Art expressions is another one. Making collages using family photos or cutouts, greeting cards. I mean, a lot of times we have greeting cards we don't know anything to do with except to put them in recycling. But here would be a great activity to do with someone with dementia, creating a scrapbook or a collage. Again, it's a low pressure way to engage with memories and images. And then painting with watercolors, drawing or coloring. Anything, with the adult coloring books can provide an outlet. Anything that comes without the pressure of a specific outcome. It's not so much on the outcome, it's more on the process. Working with flowers, putting together any kind of a flower arrangement, and then cueing in on some of the colors and the scents about it can also, I mean, it's good for the person that's doing it, the activity with the individual with dementia as well. So it's a guide to using photos to support veterans with dementia. It's a pretty in-depth. Again, this will be posted for your using if you want to, but it goes into detail about how to collect and put together a photo album and collection for for the veteran to choose from. And it shows, there's just so many ways that you can find photos, either ones you have on hand or go out and take some new ones. Some people in their older years enjoy photography quite a bit. So this can be something that, you take a hobby from someone else and use it to apply to a patient or a veteran with dementia. Here we're going to get into, sometimes we forget, and a lot of times with male veterans, may not, because of their age and the generation they were raised in, they perhaps were doing a lot of outdoor work and never really got much into doing, the nuts and bolts of household tasks. However, they have been known to be great helpers now at this stage of their life, and so we don't want to overlook that. And one thing we can do is help them to help us with our daily routines and household tasks. So folding laundry and folding socks, it can be a busy task, but it's also good for the sense of calming and purpose and routine, and it just gives another activity to factor into the picture. Having somebody help with meal tasks and, putting together things that don't require like sharp knives or something like that, but getting together things that need to be put into a dish, or decorating cookies. All of that stuff can be easily introduced into the day. Having help with setting the table also helps to feel included, or watering the plants. For those people who enjoy gardening, and a lot of us do, taking care of those indoor plants offers a connection to nature and, again, a sense of responsibility and purpose. Everyone wants to feel like they belong and have a sense of purpose. We want to definitely give that to our veterans with dementia. Again, we're going to touch on music and movement because you just can't say enough about the importance of music. and that physical activity. So dancing, put on some music and encourage gentle swaying, clapping, or even simple seated dancing. Movement to music can be joyful and engaging. It doesn't have to be elaborate. It doesn't have to be over the top. It can just be something very nice and calm. Taking that walk, a short, gentle walk, either indoors or outside, like the backyard, can help boost mood and reduce restlessness. We have some veterans at home that just make a lap from the house around through the backyard and back into the garage as part of their daily routine. And they do it maybe 2, 3 times a day just to kind of break that monotony and stretch their legs, shake it off, and get into a different space. We also have the opportunity to do seated exercises like chair yoga or gentle stretching routines. Those help to increase our circulation and flexibility, especially those struggling with limited mobility or pain issues if they do it just, in a nice, healthy and easy manner. Balloon volleyball, hitting a balloon back and forth is fun, low impact activity, and it helps to improve hand-eye coordination. And all of this stuff does not have to be done in a formalized setting. It can be done in the comfort of your living room. So the takeaways here, the important considerations are, as we talked about, keep it simple. Make sure that we adapt it to your loved one's current abilities to prevent their frustration. Our goal is to set them up for success and enjoyment, not perfection. Pay attention to, any signs of agitation, fatigue, or confusion. If the person seems upset, it's best to stop and try again later. It's okay. It really is okay if you have to put a pin in it and just wait for a little bit. You can also just shift your focus to the process. It's not the end result that counts as much as making sure that you enjoy and the person enjoys these activities. The process of engagement is more important than the final result. And then the consistency and predictability of creating a routine also helps to lower the anxiety and foster that structure and stability. There's so much more when it comes to pleasant events. We have things like watching a sunrise or sunset, holding someone's hand, providing a gentle hand or shoulder massage, going for a walk. We talked about that. Here at the VA, we do things like picnics. You can have a picnic at home, and a lot of our caregivers take their loved ones out on picnics, and they keep it really simple and easy to follow. Also, lots of events that you think might be applicable. One thing with going out into the public spaces, it's always a good thing. Just monitor if it starts to get noisy, crowded, anything that might be overwhelming, and you see your loved ones start to kind of cringe about any of that or pull back. It's a good time to just say, maybe it's time for us to go. Also taking a Sunday drive, but you can do that any day of the week. And then visiting with your family and friends, because people still do enjoy those social connections, and that's so much positive for the benefits of an individual with the diagnosis of dementia. And of course, we can't forget our fur family. Our beloved pets are so important to everyone in the family as well. So to recap, pleasant events is anything that can add pleasure to a person's day. It's a key part of what we do at the CLC to increase our individualized care and quality of life for our residents. Every interaction that you have with someone has the potential to be a pleasant event, and it helps to prevent those challenging behaviors. It reverses depression and anxiety. It lowers distress, and it decreases the resistance to care that you may be trying to offer. We also want to make sure that we keep them easy and simple, and our STAR VA training helps to provide those tools to help identify pleasant events for each person. And we remember that family members can help to identify and implement those events as well. And we have certainly communicated well with our family members to get those nuggets of wisdom that they impart to us. We also want to encourage that all of our team members can help to implement pleasant events, so you can be in any capacity, a nurse, recreation therapist, social worker, volunteer, and all of our administrative staff are included in that. So nut bolts, so that is pleasant events are everyone's job. Here are some resources that we use a lot at the VA. We use the Joy for All companion pets. We have dogs, cats, and birds. And those have been really proven to be effective for a lot of people that have had pets in their past or have a pet at home that they're not able to have while they're in their hospital here. And so we provide those to our veterans, and those have been very well received. We also have dementia baby dolls. We offer adaptive sports. We have our rec therapy team. We have program-specific groups like our low vision, and our Sioux Falls Vet Center offers a lot, as well as our primary care mental health. We have volunteer services that works well with us, and of course we are so reliant on our chaplain services, and then of course that music and memory program. So what, if I may ask for the people on the call, now that we've talked so much in depth about pleasant events, what are some suggestions or some things you're willing to share of examples of pleasant events that you have?